Well, welcome everyone to this Ask the Expert session. This will be the last expert session of this year. I'm Lori Sjogren. I'm the program director here at the National Ataxia Foundation, and I'll be assisting with today's webinar along with few of my colleagues. We're using the webinar Zoom instead of the regular Zoom that we have before. So thank you for joining us for today's first Zoom webinar using the webinar and for getting situated with us. One of the differences between with the Zoom webinar today is that the chat is disabled. So if you do have any questions for our expert today, you can type those in the Q&A. And the Q&A window, to open that, you just click on the Q&A button, and that's found at the bottom of your screen. And then we'll answer as many of your questions as time allows. And now we're so grateful to have Dr. Susan Perlman as our expert again today. Dr. Perlman is currently the clinical professor of neurology and director of the Ataxia Center at the UCLA Medical Center in Los Angeles, California. Welcome again, Dr. Susan Perlman.
Yeah, thank you so much for having me. And I see, a number of questions have already been entered into the Q&A option, and I'll just go through them as they appear. First question from Peter: is there a link between emotional health and ataxia? And there are two parts to that answer. Number one, we know that the cerebellum coordinates movement, it coordinates balance, it also coordinates speed of memory and thinking as well as emotions. So that with a cerebellar disorder, you can have some incoordination of emotional health. And that's a very broad area, could be some increased depression, anxiety, irritability, just based on the cerebellum not coordinating those pathways well. On the other hand, anybody who is grappling with a progressive neurologic disorder like ataxia is going to have situational issues. They're going to feel depressed from time to time and frustrated and sometimes angry. So I think, if your emotional health is not on an even keel, it's going to alter your ability to deal with the physical aspects of your ataxia. So it's important to know this. It's important to deal with it. Be open, discuss it with your physician, with close, family members and friends and support. So Kathy has a question. Her family has many members that are affected by ataxia. She's 74. And feels that it is getting progressively worse. So with a familial ataxia, somebody who is, in the 74-year age range, you would suspect that this is probably a later onset ataxia or a more slowly progressive ataxia, but they do tend to progress over time, either more rapidly or slowly. And after we hit the age of 50, 60, aging is going to kick in as well, either as a trigger or as an additional factor. And certainly by the time we hit the age of 80, for most people, the brain and the body is just not going to be as responsive as it was when we were 30 or 40. So sometimes just the impact of aging can also contribute to worsening. And the best way to keep up with worsening of an ataxic disorder is good health habits, proper diet, taking care of your medical issues, and exercise and rehabilitation. Penny has a question about episodic ataxia type 2. Are there subclasses of EA2? And she points out that in her family, there have been diagnoses of episodic ataxia type 2, hemiplegic migraine, and also progressive ataxia. And all of these variants are associated with the point mutation that can cause episodic ataxia type 2. And it can destabilize other pathways besides the cerebellum, hence the appearance of hemiplegic migraine and even progressive ataxia symptoms. Next question is from Marion. Have you seen anyone present with ataxia symptoms post-COVID booster? The person in question apparently has autoimmune issues. All symptoms presented 2 weeks after the booster. Tests still can't determine why the ataxia. I think we are still learning about COVID, about the infection, and about the vaccinations. So vaccinations can have neurologic symptoms. You know, we all think back to the flu shots that gave people Guillain-Barré a number of years ago. So I think this should clearly be followed. And, you know, a post-COVID booster cause for the ataxia should be further investigated and potentially treated as any autoimmune problem would be treated to see if the symptoms can be relieved. Colleen has a question about SCA5, spinocerebellar ataxia type 5 research. How does it differ from the other SCAs? You know, she indicates that it may be slowly progressing. Does it affect lifespan? It isn't known to shorten lifespan directly. It is slowly progressive, but there have been forms of ataxia type 5 that present early in life with a cerebellar dysfunction that doesn't progress, that seems to be a stable disability. So we still have a lot to learn about the underlying genetic changes in SCA5 and how it affects the cerebellum and the brain in general. Eric has a question. What are my thoughts on using off-label medication to treat the symptoms of SCA8 or other SCAs in general, and specifically asking about amantadine and NAC supplements? Given that there are no approved drugs for the treatment of symptoms of ataxia or to slow progression of ataxic disorders, pretty much everything that we have to use is considered off-label. So the drugs that have been documented in the literature in small studies over many years to seem to relieve the symptoms of ataxia, stabilize shakiness, improve walking, and potentially slow progression. Amantadine is one that's been around for many, many years, does have side effects. It can be constipating, can cause dry mouth, dry eyes, blurred vision, ankle and foot swelling, but it's worth a try because within 6 to 8 weeks of starting it, there could be benefits that could be perceived. If no benefits are seen by 3 months, it probably isn't going to have an impact. And certainly supplements like NAC, have, and other antioxidant supplements do have a literature supporting their ability to, protect the brain, protect the nerves, improve fatigability. If you're going to be using something off-label, it's reasonable to do one thing at a time, to stay on it long enough to determine if it's being helpful or not, or if there are side effects. And then if you're not happy with it, stop it, take a week or 2 off and move on to the next choice. Barb has a question about how do you feel about Adderall or modafinil for energy? Fatigue is very common in the ataxic disorders. And, over the years, activating drugs like Adderall, Ritalin, and modafinil, which was originally approved for excessive daytime sleepiness from a sleep disorder, have all been used to try to improve energy levels. They have a potential for side effects, modest. The doses, can be, changed to be very low dose to start. And I absolutely have used them in patients where fatigability is limiting for daily activities, limiting for an exercise program. They are controlled substances, so the prescribing doctor is going to be under scrutiny. And if you are getting something like Adderall from a physician to treat fatigability or low energy, it's important to get it from the same doctor, ideally the same pharmacy, so as not to draw the attention of the powers that be. Maureen has a question about craniosacral or acupuncture work. I have found that chiropractic techniques like craniosacral and acupuncture can be helpful for muscle tightness, spasm, and pain. They may not be that beneficial for movement coordination and balance. And with craniosacral manipulation, if you have any spine disease, bone spurs, disc problems, any chiropractic manipulation has the risk of, making something worse. Pinching a nerve, or acupuncture, puncturing a lung. There have been case reports about that. So I think you do have to work with a practitioner who is skilled with these, and to recognize that it could be helpful for some things, but not specifically for ataxia. Is IVF with gene testing the only way to stop SCA to be inherited to the next generation? People who carry a mutation in a gene that could be transmitted dominantly, where the child would have a 50% chance of inheriting the bad gene. IVF, with, gene testing so that the embryos that are gene negative are the ones that are then implanted, has been used by many families to, be able to expand their families with, the comfort knowing that the child, will not carry the gene. That is currently the only way to prevent, completely transmitting, a defective gene for SCA to the next generation. The technique is fairly successful. It's come a long way since it was first started a number of years ago. And the other prior options, which you hesitate to remember, waiting until you get pregnant naturally, and then having the fetus tested in utero if they're gene positive, having an abortion. I'm hoping that not too many people are still following that directive. Safisha has a question. I know exercise is important, but what type? Cardio, weightlifting, balance. And there have been a number of studies done looking at exercise and rehab strategies in the ataxias. Johns Hopkins did a study, and I think the National Ataxia Foundation on its website has some information about exercise. So the key thing with exercise for ataxia is if you work on core strength, it will improve balance. If you do balance and coordination exercises, it will help. Weightlifting, targeted strengthening, I think if you want to focus on strengthening the core, the hips, the legs, not so much, arms, would be helpful. Stretching, if you have tight muscles, is helpful. And cardio, rhythmic repetitive exercise that improves circulation, is good for brain health. And the rhythmic repetitive part of it can be, also helpful for movement coordination and balance. So I think it's important when you're designing your own exercise program to consult either with a trainer or a physical therapist, choosing the different types of exercise that are going to be most beneficial. And it's probably going to be different for each person. And then choosing an exercise routine that's not going to be overly fatiguing. You never want to push yourself to the point of pain or fatigue. So that's I think a good discussion to have with your trainer or your physical therapist. Now, Sherilyn has a question on behalf of another group member. The other group member has been having issues with vertigo and was prescribed meclizine. The meclizine doesn't seem to be as effective as it was in the beginning. Are there any other medications that she could ask about? certainly the over-the-counter medications like meclizine, dramamine, bonine, some of the others that have been used for motion sickness can help in suppressing vertigo. Two other drugs that can be helpful. One is diamoxacetazolamide, which is used for, it was originally a blood pressure medicine. It's used for glaucoma to reduce fluid pressure, and it can also reduce fluid pressure in the inner ear, which can, kind of temper vertigo. And, it may have side effects, but sometimes a low dose is all you need. And then 4-aminopyridine, now known as dalfampridine, the generic for the approved drug Ampera, has a long history of having been used for dizziness, ataxia. It is available by prescription as a sustained release dalfampridine ER, 10 milligrams twice a day. But it was originally approved just for multiple sclerosis, and its off-label use may or may not be covered by insurance. However, I just went online again to GoodRx to look for any discount coupons. There previously were no discount coupons for dalfampridine, but now some pharmacies do, in Walmart and others will have a discount coupon where you can get a month's worth for $60, $50, $40. So that would be another one to consider trying. There are a number of drugs that have been reported to be helpful with dizziness, not necessarily vertigo, but dizziness. And there's a list of these on the National Ataxia Foundation website. But if you read the fine print on many medications that you might be trying to help with nystagmus and dizziness, sometimes the side effects are dizziness, so you have to be a little cautious there. Lance has a question. Why would ataxia progress faster all of a sudden? Most of the genetic ataxias are slowly progressive. Some of the non-genetic ataxias due to the immune system problems or other environmental exposures may all of a sudden go more rapidly. But if a genetic ataxia seems to be progressing more quickly, the first thing you should think of is, have I done something different? Have I done something different with my exercise program? Have I not been exercising? Have I been ill with something else? Is there something else going on? For pretty much any ataxia that all of a sudden takes a turn for the worse, you would worry about an underlying infection. Or a nutritional issue or a new medical problem that is presenting a thyroid problem or diabetes. So with a sudden change in the course of your ataxia, it's good to check in with your primary care medical doctor. Lawrence has a question about ataxia type 6, fully symptomatic in multiple family members, initially presenting in the 5th decade of life, which is fairly typical for SCA6. There's another family member who does not have symptoms at this time, and the individual in question did have a DNA test done, 11, 12 years ago at the age of 31. Patient is now, or the person is now in early 40s. Question is whether tests have changed over the past 11 years in any manner that would change expectations of becoming symptomatic later in life. So the question is, was that original Athena test, which showed 22 repeats in this individual who was 31 at the time, now in their early 40s, apparently still asymptomatic, is there a chance that, the gene test was wrong? And my thought is, relative to other family members, if you reach the age where other family members were beginning to show ataxia and you have the mutation that, should at some point in your life, present symptoms, do you have other lifestyle factors, exercise routines, other things that you've been doing that could be protecting your brain from onset of symptoms at the typical age? So that would be one thought. And then in discussing the report itself, all the tests from Athena speak about likely to be affected with and predisposed. I think it's just Athena, saying that this gene is expected to cause a problem, but they can't comment on whether the individual at the time was having any difficulties. I would say that there's no reason to retest at this time. The testing capabilities, 10, 12 years ago are pretty much the same, and accuracy is good. But I think our newer understanding of the disease is going to lead us to look for protective genetic factors, other pathways that could be pushing back against the gene mutation. And that's why it's important to be enrolled in the spinocerebellar ataxia natural history study, where some of these other genetic pathways and lifestyle factors are being looked at to try to determine why some people, at the age of 42 are already having symptoms, with 22 repeats. Other people at the age of 75 have no symptoms. And I've seen families like that. Natasha asks, does smoking affect the brain and cause tremors and affect gait? So smoking with nicotine can, in some people, increase tremor, make you feel less steady. Think of a new smoker, somebody who's never smoked before, and, it may take a while to get used to the impact, which some people find good, and some people find, distressing, and they never smoke again. So if you personally notice that you smoke a cigarette, or you have a glass of wine, or something, unusual, you take a new supplement because you think it's going to be helpful, and then all of a sudden you feel shakier and your balance is off, reasonable to assume that what you have done has had an impact on the balance in those pathways. But many ataxians smoke, not a good thing, but they smoke, and don't have any bad effects at all. So I think it is an individual thing that you have to look for. Efrat has a question about the MJD, the Machado Joseph's clinical trials. There are 2 that are currently active in the United States. And the Steminent company in Taiwan has been planning to bring their stem cell trial to the United States for SCA3 as well, but they're not ready to do that yet. So in the Biogen clinical trial, do I know of anyone who has already received the first dose administered via intrathecal injection? If so, were there any adverse events? I don't personally know of any individual. And I know that the first group that was receiving the intrathecal injection of the low dose was not done at my facility, was done at a different facility. And those the results have not been released. There have been no reports of the adverse effects. I think they are still treating and analyzing the individuals in that initial group 1. And we should be hearing something about it as they're hopefully ready to move to group 2 early next year. Looking at the Huntington's disease trial, also using intrathecal injection of a similar type of agent, there were adverse effects, but they were seen at the higher doses. So we'll have to see how Biogen, goes over the next several months, as they hopefully are able to increase the dose and begin to look for benefits as well as potential side effects. The CELOS trial, the medication is meant to slow progression. It's not necessarily symptomatic benefit. And the initial study that was done when the intravenous trehalose was owned by BioBlast, this was a number of years ago, over the course of a year's study, a phase 2 study, did show slowing or halting of progression, but no symptomatic benefit. So I think, we're going to have to hopefully launch into the phase 3 study to see how how effective it's going to be with any target, whether symptomatic or modifying disease progression. Other companies, besides the three that we've already mentioned, working on cutting edge research. The National Ataxia Foundation on their website has a brand new pipeline that they have posted, highlighting the companies that are working on each of the spinocerebellar ataxias. Spinocerebellar ataxia type 1, 2, 3, 6, 7. So I think, go to the website and take a look at some of the companies that are still preclinical. They're hoping to be able to move forward with clinical trials, but they're still in the pre-IND phase of that. But hopefully over the next 2 to 3 years, we will have some additional studies, not just for SCA3, but for some of the other SCAs as well. Now, here's a question about, let's see if I can scroll up. Okay, I'm going to see if I can get my mouse to work and enable me to do this. Okay, Calvin asked a question about his son having received a diagnosis of UDN at Stanford. It's an ataxia telangiectasia-like disorder. It's a recessive trait, which means you need 2 bad genes to have symptoms. And, what do I know about this condition? Is there any research going on? I personally don't know about this condition. I don't think I've ever seen anybody with it. And the best way to get information about, research and clinical trials is to go to clinicaltrials.gov and look it up. The, certainly to deal with any symptomatic needs as well. Tammy indicates that she is 50 years old and recently had genetic testing found out that she has Batten's disease. I do not have at my fingertips any information about Batten's disease. However, information can be found, on the internet. I think a very useful resource for rare diseases like Calvin's son and like Tammy's diagnosis is on the neuromuscular home page, which has a wonderful, continually updated discussion of the genetics, presentation, and potential treatments for all of the known genetic disorders, in our case, that affect the cerebellum. So I think if you go to the neuromuscular homepage, click on cerebellar, you should be able to find the ATDL-D1, and you should also be able to find Batten's disease for further information. The Christy, let's see, let me scroll down to Christy's question, which has a number of parts to it. Is genetic testing that is done for children of a parent with a diagnosed inherited ataxia a blood test? No, sometimes these tests can be done on saliva. Wondering if the DNA testing to determine, could be done by blood test or saliva. Both are now options. How is the genetic testing done when a diagnosed inherited ataxian is wanting to have a child? And I think you may be referring to the IVF, PGIC testing that was indicated above. If you want to have a child, and you've confirmed that you have a defective gene, then if it's a dominant gene, then you might want to move into alternative fertility methods. If it's a recessive gene, it would be important to have your partner tested as well. Typically with a recessive disorder like Friedreich's ataxia, the individual can, have a successful pregnancy, have a child who's a carrier of Friedreich's, but will not develop the disease. However, if the other parent is already a carrier, then there is an increased risk the child could inherit the defective gene from the other parent and would then also be affected by Friedreich's. So this is something to discuss, with a genetic counselor and with your obstetrician. Does warm weather, cold weather, extreme weather temperatures make ataxia worse? Many people are very sensitive to temperature changes. In cold weather, muscles tend to become stiffer and tighter, which can alter your ability to compensate for ataxia. Warm weather can contribute to fatigue, and fatigue can worsen your ability to compensate for ataxia. How is ataxia different from MS? Many people think that this individual has MS because it sounds so similar, and MS is what people have heard about. That's absolutely true. And many people with MS do have ataxia because the MS lesions are affecting the cerebellum. Ataxia is not well known. And I agree, ataxia is not well known, although the National Ataxia Foundation has been doing its darndest to get the word out and to make sure that we are aware. I think once there is an approved drug for any of the forms of ataxia, then the genetic ataxias, the rarer ataxias, will all of a sudden be much better known. They'll be out there in social media, it'll be out there in regular media. Whenever there's a new treatment that makes an important inroad into a medical condition. If you want to engage somebody in a discussion, then you can direct them to the National Ataxia Foundation website. You can, give them, a brief summary of your genetic ataxia. If you don't want to engage them, let them think you have MS, and hope they don't recommend any treatments for MS. Do most cerebellar ataxians experience slurred speech and swallowing problems? If the part of the cerebellum that controls speech and swallowing is affected, then obviously those symptoms will occur. Some people, however, the ataxia is limited to just standing and walking. It's really trunk and lower extremity, which is a very discrete part of the cerebellum, so that not everybody experiences the speech and swallowing issues that you have indicated. And are all inherited ataxias considered cerebellar ataxia, since the brain atrophy is in the cerebellum, and then broken down by type? So technically, Friedreich's ataxia is minimally in the cerebellum. At some point, the cerebellum is involved. But early on with Friedreich's, it's the spinal long nerves, the spinal long tracts that are causing the problem. And hence we have not just cerebellar ataxia, which by definition is just in the cerebellum, but you also have spinocerebellar ataxia, where there are changes in the cerebellum, changes in the brainstem, and changes in the long spinal nerves as well. And this is an anatomical explanation, even though the symptoms can be very similar. Knowing which part of the nervous system is involved has been helpful in designing new treatments, designing rehabilitation strategies. Okay, Kunji, did you get any chance to hear an update on troriluzole? Well, troriluzole is still in a long-term open label extension. I think the company, Biohaven, is putting together a package of its data and discussing it with the FDA to see if it's at a point where it can be submitted for approval. Mia, is progressive brainstem syndrome a type of ataxia? A progressive brainstem change can cause ataxia by interfering with pathways that enter or leave the cerebellum. So it is a form of ataxia, but it is not technically cerebellar ataxia. Paul Henri, are there any medications you can take to improve balance? Well, there are no approved drugs for balance symptoms, but there are certainly, as we said before, off-label use of medications. Amantadine, buspirone, Chantix, had a small study done. Riluzole has a literature as well. And if balance is also being compromised by tremor, there are many, many tremor drugs that could help restore some stability there as well. Yoel, is it common for people with ataxia to have high blood pressure? I would say no. Certain types of ataxia, non-genetic multiple system atrophy, can have blood pressure changes. It can be high, it can be low, it can alternate between the two. But in general, high blood pressure it should be considered a separate medical issue and be dealt with to save yourself the risk of a stroke or heart disease. Lance has a question. Restlessness at night. Can't sleep because of bladder issues due to ataxia type 2. Wonders, the side effects of medication can be quite severe. Xanax for one. Depending on the cause of the restlessness, if it's leg pain, if it's leg cramping, if it's vivid dreams or nightmares, if it's just the bladder, there are medications that are well tolerated that could target each of these areas. And certainly if you're not getting a good night's sleep, your performance the next day is not going to be good. So I would recommend discussing this with your neurologist, maybe seeing a sleep specialist, trying to nail down the exact things that are disturbing your sleep, and then choose, medications that may have the lowest side effect profile that, you'd want to start with. Nicole indicates she's a student at Rochester Institute of Technology doing research. Her grandfather has ataxia, and she's been exploring the use of new technologies such as virtual reality, augmented reality that could be used to help those with ataxia. That sounds really exciting. How would I go about getting in contact with ataxia experts to help further my research and creation of new technologies specifically to help people like my grandfather? Definitely go through the National Ataxia Foundation. They have a grant program to fund the beginning of projects of the type you're describing. And this absolutely sounds like it deserves to have more research put into it. Joe asks if there are any balance exercises that I recommend. And we talked about how, core strength and doing exercises that improve balance, such that any gymnast would do or any ballet dancer would do. But you have to consult with, a learned person, either a physical therapist or a trainer, to pick the balance exercises that will work best for you, that will have the lowest risk of falling while you're doing them, and then come up with a plan about how to integrate them into your lifestyle. Kathy indicates that Dr. Kamani, who's up at Swedish Hospital in Seattle, suggested that you'd be a great resource on my SCA6. Mother's diagnosed, sister also. Her version, like theirs, affects her eyes. Is this ataxia? She's been to optometrists, ophthalmologists, specialists who couldn't see because of apparently some cataracts, but the eyes don't align. So certainly with ataxia, the coordination of eye muscles, they need to be coordinated like any other muscle in the body, so that it is not unusual for people with ataxia to have tremors in the eyes, nystagmus, to have dysconjugate gaze where the eyes don't track together. And there may be medications that can help suppress nystagmus. There may be ways to reduce double vision if it's complicating the eye movement problem. And an optometrist or ophthalmologist who works with people with double vision can be helpful. And Kunji has a question about, the Biogen first cohort. We're all breathlessly waiting information from that cohort, which is still ongoing. Maria has a question. In the afternoon, my legs get cold. Are there any drugs? Is this due to ataxia? Many forms of ataxia will affect other pathways outside of the cerebellum, can affect the peripheral nerves. In Friedreich's, that is very common. If your legs are getting cold and it's not necessarily due to, the temperature outside, typically in the afternoon, it's going to be warmer than in the morning. Are your legs getting cold because they're swelling a little bit? You've been up, maybe fluid is kind of, landing in the legs and feet and not circulating back. And that can give you a sensation of coldness. Or if there is a peripheral nerve component, sometimes the altered sensation can be felt as coldness, or, it can interfere with the circulation to the skin. So I think if you're having problems with cold legs, discuss it with your primary care doctor, consider getting your circulation tested. I think the only drug that I've heard used at low dose to theoretically help with the cold legs that may compromise some people with ataxia is low dose propranolol, which is a beta blocker that at low dose will expand the circulation and allow more of the warm blood to get to the skin. But obviously this needs to be discussed with your primary care doctor. Brad, I have been diagnosed with hypertrophic olivary degeneration after brain surgery. How do we know if the ataxia portion is progressive? If the brain surgery caused damage to an area, in the brain stem that resulted in hypertrophic olivary degeneration, the olives are important for sending messages into the cerebellum. The cerebellum then connects with outgoing pathways that ultimately come back to the olivary area. So if it's due to an injury, it theoretically should not be progressive. If it's due to a degenerative process, and there are people who develop progressive degeneration in the olives, then the ataxia portion, the tremor, and other features may be progressive. So I think you should discuss, with the surgeons and with the, the physicians who have followed you up, about the damage that apparently occurred. But I think the thing to tell here is, since the surgery, when this condition was, caused, do you feel your ataxia has progressed? I could say, well, it was an injury, it shouldn't progress, but if you're progressing, that needs to be investigated. We now have a question from Tom about anything new with IVIG. People with an immune system attack on the cerebellum, whether it's GAD antibodies, potentially gluten antibodies, or other antibodies that can be found on blood testing and are known to target the cerebellum and lead to progressive ataxia, can be treated with high-dose steroids for a short period of time, intravenous immunoglobulin, plasmapheresis, which is a blood filtering technique, or other drugs that might suppress the immune system, like Rituxan and others. So IVIG can be given monthly. It can be given maybe more frequently. It can be given less frequently, depending on the person's response. It tends to be well tolerated. It tends to continue working even after many years. I know that there are different companies that make the intravenous immunoglobulin, and they design it to make it less likely to cause an allergic reaction, so that, if somebody is doing IVIG and having a bad reaction, they might want to ask the infusion service to change companies, to change suppliers. An anonymous attendee, is it possible that a person who gets multiple types of SCA at once? Yes. I have seen families, individuals from families who have both a gene mutation for SCA6 and SCA8, or a gene mutation for SCA2 and SCA8. So depending on your family tree, you could end up with two bad ataxia genes. It won't necessarily cause an added increase in ataxic symptoms. But, certainly if somebody in your family has, shown that they have both genes, and you're pursuing genetic testing, make sure they test for both genes. It's possible that you only inherited one of them. So Mustafa has a question. Does the Friedreich's ataxia patient need to participate in person for research projects, or can one participate from a distance? The natural history study has made accommodations because of COVID for remote visits, where certain things can be done remotely, certain things cannot be. Parts of the exam can absolutely not be done without an in-person visit. And similarly, for some of the drug trials that are ongoing now, that had to make, compromises during COVID. Some visits have been changed to remote visits, but in-person visits will continue to be required at some intervals. And certainly starting a new research project, if an exam is part of it, if a drug trial is part of it, you're going to need to participate in person. And it's, certainly we need to hope that there will be more research sites opening up. Drug companies that are developing new drugs for Friedreich's and others have been looking out for international sites so that they won't just run a trial in North America. They will actually try to have sites in Europe or South America or Asia. And I think we need to try to encourage that to make it easier for people to get to a research program in person, because that will ultimately be the requirement for most studies. I got a hi here from a patient. Hello, Una. Denise, how does ataxia affect the colon? Specifically asking about Friedreich's. So any ataxia where you become wheelchair bound is going to slow up your GI tract. And so it's important to pay attention to your digestion, to avoid reflux, to avoid problems with constipation. Friedreich's ataxia, because it involves the peripheral nerves, and is known to affect peripheral nerve performance connecting to the bladder, to the bowels, could contribute to slowed bowels that might respond to some of the Linzess type therapies that are out there. So if you find that your bowel habits are changing, and constipation, being, probably the most obvious, don't ignore it. Try to do what you can with diet, with fluid intake, with appropriate medication to keep our GI tract running smoothly. Kathy, my husband and I have been married for 41 years, and I no longer recognize him as a person. I feel as though I'm living with a stranger. It's very sad. He's very angry and frustrated. Do you have any suggestions? So, assuming that Kathy's husband has ataxia, and we discussed already that the cerebellum coordinates mood and behavior the same way it coordinates, balance and hands. So it's possible the anger and frustration are being fired up a little bit by the cerebellar disorder, but also the frustration of symptoms that can't be cured, of problems that just seem to get worse from year to year, can absolutely cause a situational anger and frustration that can really consume a person. I think it's extremely important to discuss this with your husband's neurologist. It's extremely important to consider meeting with a therapist, not necessarily a psychiatrist, but a therapist, to talk about his feelings, to talk about your reaction to his feelings, and to talk about things that can be done in your environment to relieve that. Certain medications can be helpful. If it's the cerebellum that has, kind of opened the switch on incoordination of anger or irritability, there are medicines that can, restore some balance in that system. But the medicines can only do so much. You really have to work with the person's living environment, the people that he interacts with, and the things that are most meaningful to him. Do not let this go on. There's always a risk of somebody with a progressive incurable disorder thinking about suicide. That needs to be talked about. And we see on TV many ads now about, if you're feeling depressed, if you're feeling suicidal, don't keep it inside you, talk about it. So communication is going to be really important. I'm fortunate in that over the years, I can't think of any of my ataxia patients who ultimately killed themselves. Although with some of the other genetic disorders I work with, there have been a few. So I would say, move quickly and supportively to deal with this. Mia, does an anti-inflammatory diet such as the Wahls MS diet help people with ataxia? And I know I did a webinar about dietary interventions, as they might affect the immune system, they might affect inflammation. The gluten-free diet for people that have a gluten ataxia has been found to be very helpful. The anti-inflammatory diet, the Wahls diet, which I've looked at, is not an unhealthy diet. It is certainly something you could try. And as with any, over-the-counter medication or nutritional approach, you would need to work with it for at least 3 months to get a sense if it's helping you individually. Connie, I'm waiting for the results of genetic testing to come in. My neurologist said it might come back negative. Where does one go from there? Depends on the genetic testing that was ordered. The usual series of tests, if there is a known genetic disorder in the family, then you can start with that test. If there's, an unknown genetic factor in the family, you can screen for some of the common ataxia genes. If that comes back negative, you would then go to the medical version of 23andMe. It's called whole exome sequencing or next generation sequencing, where they look at all of the genetic factors, many of which are known to be involved in ataxia, some of unknown, to look for any changes that might track with your symptoms. Sometimes it's difficult to get whole exome sequencing approved by your insurance company. So it's important to work with a genetic counselor to make sure that if it is ordered, it can be validated and, appealed if there is, a negative, feedback from your insurance. There are companies who offer whole exome sequencing at a relatively cheap rate, something around $1,000, which isn't cheap, but compared to whole exome sequencing at some other institutions where it could be $9,000, $10,000, it seems to be a bargain. So, I think it's a discussion to have with your neurologist. What genetic testing was sent? How comprehensive was it? And would whole exome sequencing be the next step? Even with whole exome sequencing, there's no guarantee it's going to show anything, but reanalysis of that data in another 2 years or 3 years might show a new factor that has been identified to be involved with ataxia. Cindy was prescribed dalfampridine for downbeat nystagmus. I think that's what DBN is. What side effects have your patients reported? I have cerebellar ataxia. Dalfampridine was approved, as I said, for gait disorders and multiple sclerosis, but it has a long history of use, having been compounded. 4-aminopyridine was the old name of it. Compounding pharmacists were using it for decades for spinal cord injury, for ataxia, for vertigo and dizziness, so that, there's a long history of its benefits, and it's absolutely worth trying for nystagmus, for ataxia in general. However, too high of a dose lowers the threshold for seizures. So it's important, if you have a history of having had a seizure or a history of epilepsy, this could lower your threshold for recurrent seizures. I have had some patients on the compounded formulation, who said that they felt a little woozy on it, they felt tired on it, but most of my patients who are taking dalfampridine, either compounded or by prescription, are not having any side effects at all, and the worst they can say is it may not help them. So George has a question: what is the difference between ataxia and CIDP? So CIDP is a chronic inflammation of the peripheral nerves, which can cause weakness, it can cause numbness, altered sensitivity in the feet and legs, can lead to what's called sensory ataxia, where because the input from your feet about where your feet are and what you're stepping on is not getting to the cerebellum, and hence the cerebellum can't perform optimally, and you'll feel off balance, you'll stagger a little bit, and your feet will kind of get in the way of where you want to go. So ataxia can be caused by problems in the cerebellum itself, by problems in the connections going in or out from the brainstem, as we talked about previously, or by problems with vision, problems in the inner ear, and sensory problems such as the inflammatory disorder of CIDP. Sometimes it's multifactorial. The older we get, the more things can go wrong. We might have a vision problem, a little inner ear issue, and have an acquired ataxia just on that basis, the cerebellum being otherwise normal. Natasha, is an MRI test needed to determine the level of ataxia? The MRI is most helpful in determining the site of an ataxic disorder. Is it in the cerebellum? Is there some change in the connections in the brainstem? Is it a problem above the cerebellum, since the upper part of the brain does give important signals to the cerebellum, so that you can have ataxia coming from any of the areas that we discussed with George, and a brain MRI or a spinal MRI can help determine, where the defect might be being felt. Now, to determine the level of ataxia, MRI is being used in clinical drug trials as a potential biomarker, that if you're working with a drug that could protect the nerves in the cerebellum, allow some of the nerves to heal, you might see improvement on the brain MRI. But just looking at the MRI, there could be a lot of thinning in the cerebellum, but if it happened over a very long period of time, the brain had enough time to adjust, so the ataxia could be very mild. On the other hand, somebody who has an acute, severe attack on the cerebellum, they're having surgery and they don't get enough oxygen, and they have anoxic brain damage. They may wake up with a severe ataxia, and the cerebellum initially looks totally normal because it hasn't had a chance to deteriorate yet. John has a question. Can your muscles be attached? I'm not sure what that means. And perhaps John can expand on it and put in another message, and we'll talk about that. Mustafa, my daughter is diagnosed with Friedreich's, age 26, confined to a wheelchair, but would like to participate in a research project. Are there opportunities for her when she is living in Turkey? There are European sites which are relatively close to Turkey, and we're talking relatively here. I know that there are sites in Austria that we have referred some of our Greek patients to. So I think it's going to be important to go to clinicaltrials.gov, type in Friedreich's ataxia, type in, I presume you're looking for a treatment trial, and see which opportunities come up. And certainly, there are people that could help you with navigating that website if you have any problems. Bridget, what about NAD nicotinamide riboside to slow SCA7 progression? I know that it is being looked at in Friedreich's ataxia as a way to improve energy production and protect the nerves in Friedreich's, which are compromised by an internal energy crisis. Would such drugs have any impact in the other ataxias? The other ataxias may involve decreases in energy production, that the mitochondria that generate energy in the nerve pathways could become innocent bystanders. So some of the mitochondrial targeted treatments like NAD nicotinamide might be helpful, but they do need to be tested in controlled trials. Joanne says, my sons have epilepsy and she has genetic ataxia. Is it common for children of ataxia patients to have epilepsy? There are certain genetic ataxias that when passed on may become more severe or change in their presentation in the children. So it depends on what kind of genetic ataxia you have. Otherwise, I would say that given that both your sons have epilepsy, I wonder if there's an epilepsy risk gene that they both inherited that is unrelated to your ataxia as well. And we've got about 1 minute left, and I'm going to have to stop at that point and go to clinic. We have some additional questions from, some people who have already, had some questions answered. So I'm going to skip down a little bit. Does deep brain stimulation help with SCA1? Deep brain stimulation with implanted electrodes does have complications, one of which it can increase ataxia. Now, non-invasive strategies, transcranial magnetic stimulation, does have some evidence of being beneficial for ataxia. So I think we should look at the non-invasive strategies. And then Rita is mentioning Dr. Thomas Klaus in his book, Reclaiming Natural Movement. Dr. Klaus, had some very good strategies for reinforcing, movement-related pathways, and it's absolutely worth a try. And he's been a wonderful support to ataxians, for many years. AOA2, foot swelling. Nothing new on that. So you got to keep your feet moving, elevate them if they're swelling, make sure you don't have something else contributing to it, and decrease the salt in your diet. And I think I'm going to have to stop now because I have to get to clinic. But this has been, tremendous, and I'm sorry I couldn't get to everybody's questions, but, certainly, we'll hopefully have another session at some point in the future.
Absolutely. Thank you so much, Dr. Perlman, for answering so many of the questions today. We had just a ton of great questions submitted again for this session. And thank you all out there for attending today's session. A recording of today's session will be made available on NAF's website and on NAF's YouTube channel. So take care, everyone, until next time.
All right. Bye-bye.
Bye-bye.